Hey everybody, we are live. This is How to Pass NCLEX. I'm so happy to be here with you guys. I'm the #1 NCLEX instructor for you today on Monday. My name is Regina Callion, and this workshop is presented by ReMar Review. I have the best nursing students who we're all just studying. We're trying to pass NCLEX. So if your goal is to pass NCLEX, come on in. We're going to do a workshop. And I have to let you know that in order to be successful, there's work you have to do. The NCLEX is changing. The NCLEX is changing. I did a presentation on this a couple of weeks ago after the NCLEX conference, but most people are still asking me, when is it going to happen? Well, the new NCLEX RN and PN test plan is set to launch in April of 2023. So my new graduates, this is when that change is going to happen. And what we're going to see is we're going to see incremental changes. And so the test plan, the test questions, they will be based off of the clinical judgment measurement model. Clinical judgment measurement model. If you are not hearing this in school, if you are not hearing this from your instructors, you will definitely be hearing about it from me, because this is going to be the way that NCLEX is going to determine whether you, as a nursing student, you're able to think critically. So some of the changes that we're going to see on the next generation NCLEX are going to be this, where you have the laboratory data will be given to you now, right? So you don't have to memorize a list of lab values, because they will be given to you, because in real life, they will also be given to you. So we want to make this as real as possible. Hey, come on in. Welcome if this is your first time. Marie says, hey, Regina, I passed my NCLEX 4 months ago, but I still love watching you. I still love you being here. Okay. I still love you being here. Also, some other changes that you're going to see are up to 10 answer choices. So, you talk about knowing your content. Yes, you're going to have to know this information, because you're going to get more choices to choose from. Partial credit. Yes, partial credit will be presented for all select all that apply questions. All select all that apply questions. They will now have the partial credit. So you'll get a point for the correct answers. And you also, in some cases, will get points taken away if you choose the incorrect answers, right? Case studies. So today we're going to be doing some case study work, as well as having single and multiple cases. So come on in. This is a ReMar Review. Shout out to all of my nurses, like Stella just says. Hi, Miss Regina. Thank you so much for everything. I passed my NCLEX PN. Amazing. Good Monday. Happy Monday. That is certainly good news. Our critical thinking exercise today is name that diagnosis. Name that diagnosis. So this is going to be comment heavy. I want you to comment. Let me know what the diagnosis is. I'm going to present the case and the symptoms, and you tell me what the diagnosis is. So this is going to be a fun game. Share this NCLEX video with your friends who love to think outside the box. That's what we do here. So our first patient, are you guys ready? Do you get the idea? I'm going to give you the list of symptoms. You tell me the diagnosis. And these diagnoses are things that you guys should be very familiar with for your NCLEX exam. Let's go. Patient letter, not number, A. Here we go. All right. Patient A has these symptoms. They have they're nauseated after activity, shortness of breath, crushing chest pain, pain radiating down the left arm, feels better after rest. All right, guys, based on the symptoms, what do we say this patient has? Click fingers, put the comments on the screen, and smash that share button right now. So we have nauseated after activity, shortness of breath, crushing chest pain. I'm trying to give you guys the clues in here. radiating, pain radiating down the left arm. But the patient feels better after rest. That's something right there. That's something right there. What do we have here? I love it. I see the answers on the screen. I see them. I see you guys. Well, I see 2 answers on the screen, but only one is right. Only one is right today, guys. The 2 answers that I see on the screen are angina, or some people are putting an MI. But what would you say this is more leaning towards if you had to just pick one? Because I have my answer. Is it angina or is it an MI? Nauseated after activity, shortness of breath, crushing chest pain, pain radiating down the left arm, feels better after rest. Yeah, this is going to definitely be acute angina. Acute angina. Good job. Good job. I love it. Come on in. You made it to the live class. You made it to the live class if you're here. We have many more patient presentations. Here is the next one. Are you guys ready? The next one is this. Patient B. Patient B. Confusion. Headache. Right-sided weakness. Difficulty ambulating. Difficulty speaking. What does patient B have going on? What would you say if you had to if you had to say, well, what is this? Eric got it so quickly. I thought it would take a little bit of time. I see a lot of different answers though, but Eric, you got it. This patient has confusion, headache, right-sided weakness, difficulty ambulating, difficulty speaking. This is fast thinking. And I hope I'm jogging you guys' memory and you're like, oh yeah, I need to study that. I definitely need to study that. Yes, this client has it. You guys got it. I see it all. I see it. CVA, stroke, CVA, stroke. The correct answer is the cerebral vascular accident. Yes, come on in. Oh, some people put Alzheimer's. This is really good. But Alzheimer's doesn't give you the right-sided weakness, even though you can have confusion. Definitely difficulty ambulating, difficulty speaking, but this is more appropriate for a cerebrovascular accident here. Okay. All right, let's go on. Let's try another patient. Let me see if you guys are fast fingers today. Patient C is this. Nausea and vomiting. Navel pain that has spread to the lower right abdomen. Got some flank pain. Pain that worsens with cough. No appetite. What in the world is this? I wonder if I'm looking to stump you guys. I'm challenging you. You guys know every Monday we do this. Every Monday we get together and this is how we check in with each other. This is how I make sure that you guys are appropriately up for this challenge of passing NCLEX. I expect you to show up on Mondays. This is where you show up to study ReMar review. So the patient has nausea and vomiting, navel pain that has spread to the lower right abdomen, and then also flank pain. What does that mean, flank pain? Where is that? If somebody, or if you read that the patient has flank pain, pain that worsens with a cough, and no appetite. The patient is not hungry. And for most of us, when you're not hungry, something is wrong. Go ahead, type those answers in. I can't wait. Facebook is doing excellent. All right. The answer that I am looking for, the answer I want you to know is right here. It is appendicitis. Did you get that one right? If you got that one right, just give yourself a little pat on the back, because I tried to use some atypical symptom presentation and you still figured it out. All right. Patient number D is coming at you. Patient letter D is coming at you. Here we go. Okay. All right. Now this is the one. This is the one right here. This is the challenge. Patient has a rash on the body. The itching that they have, it worsens at night. It gets worse at night. And wrists, between fingers, and elbows bent. They're the most affected places. And then the patient also has crusty sores. What in the world is this? There's a big clue in here, though. I'm not going to say it just yet, but this is a pimply rash that itches, and it's affected most at the wrists where there's bends, between the fingers, tight knit spaces, right? Between the fingers and the elbow. Then do you know what it is? Yeah. Some people do. This is how you study for NCLEX. It doesn't matter. If you know, like I said, if you guys know this content, it doesn't matter how the question is presented to you. It could be a case study. It could be a fill in the blank. It could be a select all that apply. You're going to know what it is. Not because you've memorized some decision tree or you've, hacked the NCLEX somehow. It's just you're very competent. You're very competent with your information. So the correct answer for patient D is this patient has scabies. Yes, this is scabies. With scabies, a characteristic sign of the rash that you have, it gets worse at night. So if you didn't know that about scabies, go ahead and write it down. Go ahead and make a mark of it, because the itching, the scabies, the little mites, their activity increases at night. So the itching gets worse at night. Put a heart around scabies if you know you need to study this topic today. All right. This is how you do it. Good job, everybody. Good job. All right. The next patient, here we go. The symptoms are, this is patient E. So we have here rectal pressure, bloating, nausea, vaginal bleeding. That should say vaginal bleeding. I apologize, guys. I'm still recovering. And right lower abdominal pain. All right. Here we go. Rectal pressure, bloating, nausea, vaginal bleeding, right lower abdominal pain. What could this patient have? What could they be at risk for? What do they have? What could they be at risk for? Pop up quiz based on the symptom alert. I haven't seen the right answer yet. I haven't actually. So come on, put your comments on the screen. It may be you may have the right answer, and your patients need you. I mean, your classmates need you today. I see constipation. I see irritable bowel syndrome, endometriosis. No, that's not what I'm looking for. Not quite. This is you want to know this one because it's considered an emergency. So you want to make sure you know this one. All right. And the correct answer here is going to be this: ectopic pregnancy. All right. This patient comes presenting very abnormal. This patient, they might not even know that they're pregnant. And so we as the nurse, we have to be able to know these signs so that we can check out this person. All right. Because the pregnancy tests that they may take, sometimes it may come out negative if they don't have enough of the HCG hormone in their bloodstream. But sometimes it could be positive too. All right, next patient. Here's our next patient. All right, next and final patient. I'm not going to keep you guys long today. This is all about making sure that you are in the mind frame to study no matter what. All right. So here we go. Frequent urination, temperature of 102.5, a burning sensation during urination, chills, nausea, foul smelling urine odor. What would we say this patient has? What would we say? Oh, come on in. Yes. You guys got it. That was quick. Absolutely. And this I could also put sudden confusion, right? Because this will make you have a sudden sense of confusion. Maybe patient is combative, right? So if any of our elderly patients have this condition, we know these are the signs of the urinary tract infection. Yes, the urinary tract infection. Okay. All right. So this, guys, was a really great way for me to test if you have been studying the content in your virtual trainer. This is my my full review program for your NCLEX exam, where you have all of my lectures, right? The content is interactive, it's engaging. What I love about it is that it allows you to critically think, right? Critically think. You need to be able to do that in order to pass this exam. And so if you are studying my virtual trainer, the homework and the progress exams are very important. The NCLEX virtual trainer gives you homework and gives you progress exams, so you're able to check to see, hey, am I learning what I've been studying? A lot of nursing students make the mistake of studying without accountability. And so you don't make progress as fast. That's why it can take 6 months or up to a year in order to get your license. It doesn't take that long, really. But if you don't have a system that you're accountable to, then it could. All right. So the daily study calendar as well comes with the virtual trainer. Use it for your advantage. The step-by-step calendar is a unique feature that the virtual trainer provides for you guys, as well as the physical workbooks. Those help to have you taking your notes, making sure you're writing down. I want you guys to get your license. There is 2 more months left in this year. You can pass NCLEX in the next 6 weeks or less if you use the VT, if you take the journey inside of the virtual trainer. All right, if you take the journey inside of the virtual trainer. Kendra says, I'm going through the VT for a second time. Love the program. That's what I'm talking about. Being able to do that. I want you guys to be a part of our success rate. It is a phenomenal, especially our program that is designed for repeat test takers, those who struggle in the past. This is the program for you, because maybe one of the reasons why you struggled was because you needed to have that guidance. You needed to have the progress exams. In the virtual trainer, if you have it, you know that every quiz, you have to get a 95% on, right? That is the accountability that I'm talking about. All right. You need to pass with a 95% in our quizzes. And so that's what helps students do. That's what helps you do better on your exam, because you're up for the challenge already. And so right now we have an amazing discount on the virtual trainer. Team ReMar put it in where you can get $140 off the virtual trainer right now. And we are still doing the free shipping internationally, free shipping domestically. All right. This is the opportunity for you guys right now. So if you click on the link, take advantage of the sale that we have going on for the virtual trainer and get started immediately, because nothing is going to be more beneficial than you getting your nursing license and making the money and having the job that you want and the career that you want. The holiday seasons are coming up, and you guys know if you're working at a job that you are not happy with, the holidays can be so stressful because you have to work twice as hard for basically the same pay. I want you guys to have let this be the final holiday season that you don't have your nursing license. So we're ready to help you right now. Team ReMar, they're standing by. And I am super proud of you. If you had fun studying today, if you had fun, just going through your NCLEX information, trust me, this process could be so much easier. Marie says, guys, I like this comment. It says, guys, please listen to Regina's VT and Quick Facts. Both helped me. 90% of my questions were from both of those books. Amazing. Love my ReMar nurses that come on. Listen, amazing. And I want this for you guys. I want you to have not only the nursing dream job, but I want you to be able to give back. We need nurses so much. We need nurses so much right now. So do not go into next year. Do not go into 2022 without your license. This is it, guys. 2 more months into the year. What are you going to invest in? Let this be. Talking about holiday gifts and purchasing things for the holiday. Purchase the virtual trainer. Gift yourself the gift of having your nursing license and being ready for this test. You guys can do it. I say it all the time. You can, you will, and you must pass NCLEX. And I believe that. So have a wonderful week, and I will see you guys later. Bye-bye.